Congressman, it's nice to meet you. My name is Robbie Contino, and I'm just so inspired by all these stories, so thank you all for sharing. I am an internal medicine and pediatrics physician. I'm the CEO and a co-founder of ethne Health. And at ethne Health, we are a medical home. We're in Clarkson, Georgia, so we all make kind of one of the most diverse square miles in America. We provide primary care, we provide dental, physical therapy, and mental health services or psychiatry. We offered care in over 70 different languages last year. And we love to hire from the community, and so on staff we have 24 languages in-house. And so we take care of people of all ages, and that includes children. And so that's why I'm so excited to be a part of this discussion. Medicaid for us, for our organization, and for the patients that we serve is a lifeline. We see about 400 to 500 kids a month. Most of those children are living in poverty. About 70% of them are on Medicaid. And so for an organization like ours that is really trying to look to systematically shape ourselves so that barriers to accessing good healthcare are overcome, we operate on thin margins. Right? So a cut to Medicaid would be devastating. But I'm more concerned about the patients that we see in the clinic every day and what that means for them. You know, Medicaid right now is, to be honest, in the medical community that we're a part of, not a lot of people take it. And when people lose it, there's even less options. There's nowhere to go. And I think that just this past week, we had a mom in our clinic. She was getting blood drawn by one of our phlebotomists, and she was crying. And it turns out that she was crying because she was holding a letter in her hand that she wasn't able to read. But she kind of got the sense that for whatever reason, her kids were being removed from Medicaid. Because what parents know and what we know is that lack of Medicaid means lack of access. It means school absences, because kids can't get into school without the vaccines, without the screenings, right? It means lack of access to hearing screenings, vision screenings, developmental screenings, nutritional screenings, and linkage to early intervention services, right? Which we know are critical for healthy families, right? It means that kids with complex medical needs, that we see in clinic with type 1 diabetes or cerebral palsy or need to be fed through a feeding tube, right, have no access to that care. And it means clearly that problems that can be addressed early on, maybe in the office, right, if people don't have access to care, these problems get worse, then they go to the ER, they go to the hospital, or in the ICU, right? All these are issues that we can effectively address in the primary care world, right? And so I'll end with one story. We had a mom recently that came to see us, relatively new to America, was late to get on Medicaid, was pregnant, in the third trimester of pregnancy, and because of the lack of being able to link with Medicaid, didn't have a provider for prenatal care. She ended up coming to see us with a toothache, and by that time it was too late. She ended up very sick, going into the ICU, something called Lanier syndrome, which it starts in the mouth. It's an infection that goes into the neck and then down into the chest, right? And so this mom in third trimester of pregnancy survived, but her baby was lost, right? Something that clearly could have been addressed with access to care. And so these are the types of things where I say that, cuts to this program would be devastating. So thank you for having us.
Thank you.
Congressman, thank you again for having us. And I echo Alejandro's words of fighting the good fight. Our thoughts and prayers are with you as you hit that. We appreciate that. And I'm Chad Jones. I'm with Viewpoint Health. We are one of 23 community service boards in Georgia. We operate, use Matt's word, the safety net. They call us the safety net provider because almost all of our clients are going to be uninsured, underinsured, or with Medicaid. Our main catchment area, Congressman, is Gwinnett County. Our home is Lawrenceville, so we serve all of Gwinnett County, Rockdale County, Newton County. We have several programs, about a dozen programs that we do in DeKalb and Fulton as well. Across the board right now, we have 700 employees and we have almost 200 programs. Those programs range everything from what we're doing in we are a certified community behavioral health clinic, so we have a CCBHC grant. I know you're familiar with the CCBHC work. We have right down the road, Sigmund Road, just a few miles from here, we have an autism crisis stabilization unit. We have other stabilization units. We have a robust, we were talking about this earlier before you came in, we have a very robust play therapy program we're excited about. Working with birth to 5 years of age, really growing that. Do a lot of work with accountability courts. We work with a lot of judges. We have law enforcement programs. We also have programs where those clinicians are embedded, working alongside law enforcement officers. We call them co-responder programs. Do a lot of school-based. We have clinicians that are actually embedded in the school. So we do a lot of work, a lot of community type work. Just to let you know, last year we served over 18,000 people. In that, we do a lot of housing as well. So we cover a lot of ground in terms of working the homeless population and getting folks housed. You've heard a lot of folks talking about around this with this extinguished panel, and great to be part of this group, that the cuts to Medicaid will be cuts to services. I'm going to add to that a little bit. We know that. We know cuts to Medicaid are going to cut services and cut access, but it really is going to cut the creativity of the services. And I'll give you an example. Our clients, 18,000, and 95% of those are funded Medicaid, low income Medicaid, peach care, whatever you want to call it. They're going to be funded, or uninsured. So we're serving that population. The Medicaid services allow us to get creative and do in-home types of services, more assertive intensive services, the play therapy I mentioned. There's a lot of care coordination types of things. Those services are covered by Medicaid, that if Medicaid was cut and wasn't there, guess what? Those go away. So it's like me going to all of you all and saying, hey, give me your iPhone 16 and I'm going to replace it with an iPhone 4. The private sector can provide outpatient services, but that's all you really get. Private insurance services don't cover in-home types of work and intensive types of work and behavioral aid types of work, those types of things. So it's a phone, it worked, but it's an iPhone 4 compared to what the 16 can do. So Medicaid actually gives a more robust level of services. So it's not just cut to services, it's a cut to creativity of the services that gives a robust continuum of care. That's really what it is. And then secondly to that, because when you look at you're looking at the actual services, you're looking at the workforce that are trained to do that. I mean, you start cutting the Medicaid, you start cutting those services back, you really cutting into the workforce. Let's be real. These folks are being trained. Right now, we met with University of Georgia the other day, go Dogs, with the School of Social Work. They are actually building the intern program to build a full continuum of care. So they're going to start meeting with us. They actually send us interns now. The workforce is being trained now on this full continuum. So if you start cutting Medicaid, when do you cut the continuum? And that gets into the whole workforce piece of it. So I just wanted to highlight, I want to get into the weeds a little bit, Congressman, of it's not just cut to services. We know that, both sides of the aisles know that. It's cut to what those services are actually doing and the creativity of those services and the robust nature of those services compared to just being, well, here you can just get outpatient with private. So a little bit more detailed than that.
Thank you.
Thank you all. Good morning, Congressman. Thank you again. My name is Goldberg. I'm the Research and Policy Director at PEERS. We're an early childhood policy research and advocacy organization, and we're honored to be asked to pull together this amazing group of professionals and families to really put a face to some of the numbers and some of the stories. So we really know that whether we're talking about early learning, or healthcare access, or nutrition, that federal funding really underpins, all of the services upon which Georgians rely. And, we in the early childhood space are particularly concerned that these potential cuts could have significant effects on those who are most vulnerable, including our youngest children. So for example, Medicaid in Georgia covers almost half of our births in the state. Medicaid also covers over 40% of Georgia's children. We know that SNAP supports food access for more than 200,000 children across the state. And we've heard so much about Head Start and not just the early education services, but that wraparound support that are provided to over 20,000 of our youngest Georgians. And so really grateful for your attention to these issues and want to underscore again how grateful we are to each of you to coming and lending your voice to this discussion. I know there's an endless list of questions we could ask. I do have a couple of specific questions sort of targeted towards early learning and nutrition and Medicaid, if that